Good morning, everybody. We're going to keep going with the altered mental status lecture here. Next question is hypoglycemia. Real short lecture, but
real important.
I see a lot of questions on it as well.
Yep.
All right, so hypoglycemia, yeah, very commonly seen in the emergency department. So clinically, it's going to be someone who's diaphoretic, tremulousness, tachycardia, they're altered. Heck, they're going to have focal neurologic deficits on it, you know, stroke mimic, right? Can cause seizures. We covered that in the previous lecture. So a wide range of clinical presentations with something that's so simple to diagnose, right?
Yeah.
Point of care glucose.
Yeah, but it's so easy to forget, and that's a problem in these high-stress situations. It's so easy to just dive right in and go for IVs and everything else and forget 100%. To just get a finger stick. So
absolutely.
It's important to remember to ask for that at the beginning of any of these.
Yeah. So a bunch of causes here, and I think we've covered a couple of these as well. So medications, a lot of these focused hypoglycemic questions will come from are medications. Beta blocker overdoses, I always have to throw that one in as well, because a lot of times you'll have questions on is this a beta blocker overdose? Is this a calcium channel blocker overdose? And they give you hypoglycemia, and it pushes you towards that beta blocker overdose. Alcohol abuse can obviously cause this. Infection, think sepsis, liver failure. If it's pediatric, thinking your congenital defects in metabolism, your inborn errors in metabolism as a cause. As far as the anti-diabetic agents, a lot of questions that I've seen are, patient presents with hypoglycemia, which of the following, if overdosed upon, warrants admission, or who can you send home versus who do you need to bring to the hospital? So knowing long-acting insulin, Detamir, Glargine, those need to be admitted to the hospital, and you got to watch those and, put them on, keep their glucose up as you're waiting for this long-acting agent to get out of their system. Versus if it's like a rapid agent, Aspar, glulisilene, Lispro, not as serious as a long-acting medication. Your treatments, you're looking for IV or oral dextrose, octreotide always comes up. So anytime there's an intentional insulin overdose, or if it's a long-acting insulin overdose, what is the disposition? You need to admit that patient. These ones cannot be sent home. And then as far as out of all the different antibiotic agents, the one that oral. I feel like always comes up, oral antibiotic, yeah.
Oral antidiabetic agents.
There you go, yeah. Commonly comes up are the sulfonylureas. So know what these are and know their names. So if it's glimepiride, glipizide, and glyburide, know these ones, and it'll have it in the question stem. It's 50-year-old diabetic, male comes in, hypoglycemia, medication list includes. They'll give you, lisinopril, whatever it is, and then glyburide will be in there or something. Yeah. And it'll ask, what is the disposition? And it'll send home, follow up with, primary care about the next 2 to 3 days, admit for observation. And this one is definitely an admission. IV dextrose, octreotide is what you're looking to treat for. And again, if this is a pediatric situation where, a child got into mom's medications, here's the med list, and glyburide is one of them. This is under the list of one pill can kill, and it's very, very serious, very poor outcomes, and so these need to be admitted. And a lot of that, I think, is disposition questions and treatment.
Yeah, this is one, even if the question says, pediatric patients brought in by mother may have taken one of her glyburide. Yeah. The decision's always going to be admit for observation.
Perfect.
So this is one where there's really not another way around it. It's pretty clear answers.
Awesome. Remember, glimepiride, glipizide, glyburide. Know your sulfonylureas.
Yep.
Yeah, don't get them confused with all the other ones. Yeah. All right. Insulin pumps. This one comes up as well. I think I had a few questions on them, but we'll cover it here since we're in hypoglycemia. Malfunctions are pretty rare. It is pretty straightforward. If they're hypoglycemic, they got an insulin pump, please turn it off. Remove it from them, and then start treating with sugar. That's about all.
Yeah. And I think that's it for this.
And that's all. Yeah, real easy. Thanks, guys.